Hi guys, welcome back to my channel. I am super late on this video and I apologize for not getting it out sooner. So in this video, I'm going to show some lab videos from about 3 weeks ago. I did finish my last term 2 weeks ago. We had a week break and now we're on term 230, which is our ICU and ventilators term. So this whole term is going to be all about ventilation and ICU. Next week I have to get my ACLS certification. I think like the second to last week of this term it's going to be our PAL certification. They also during our break last week had us do a practice TMC test. So the NRBC has a practice test out and you can go and take it. So I took it and I got a 72 out of 140, so that's 51%. To get your CRT certification, you need an 86, I believe, to pass to move on to the CSE. I think that's what it is, the clinical simulation exam. You need a 96 on the test. So I was pretty proud of myself for getting at least a 72, because that's not that far from an 86, which for your CRT. And I did that without having done any ventilator information or peds. So I thought I was pretty good. I was like proud of myself, because that test is a whole bunch of ventilators, like a lot of ventilator questions. So we just started yesterday and I'm about to, after this video and editing, I'm about to start studying and making flashcards because it's already a lot of information that I have to go over. Last term, I finished with an A. I finished with a 90 or a 91 in the class. Our final was worth 45% of our grade. I got an 88 on it, but they threw out one question because a lot of us missed it, so I got a 90 on it. And I was actually pretty proud of myself. I made a 95 on my lab simulation exam, or I'm sorry, lab practical exam. So that was really good too. I was told we're going to clinicals in 3 weeks. I don't know, I'm gonna ask my program director next week when we go back to the lab. I'm kind of nervous, y'all. I'm very nervous. Like, I don't feel prepared. I know the information and all that, but I don't feel prepared for hands-on. So we'll see how that goes, and if that is true, I will let you know and keep you updated with that. So this video is really just kind of update you where I'm at right now in class. I don't think there's anything else that I want to just discuss with you guys other than that's where I'm at. We technically have 29 weeks left of this program, ends March 14th in 2021. So I have 29 weeks left of it, and I am excited because I'm ready to be done and get out there and start working and making money. But I will see you guys in my next video. Enjoy the lab.
When it's time to use it. All right, notice. Let's do this one step at a time. Okay?
Try to see if you can see that, because I have a really good angle.
Yes.
Okay.
Lift up right there, not where you are.
Okay,
You see it now?
and haha, he lives. Hi, Mr. Smith. My name's Kiana with RT. I'm here to clean your tray. So first thing I'm going to do is I'm going to suction it, okay? I'm going to take off your oxygen mask for you. All right, we're going to set this aside. All right, we're going to suction. Thank you. think this might be too small for my fat hands.
Normally you wouldn't have another pair of gloves on, so it's okay. If you can't get them on.
Okay, this is too small for my fat hands.
Normally you wouldn't have another set of gloves you're fighting with.
Okay, so I have my sterile gloves on, and now I'm going to set up my sterile procedure area.
Mm-hmm.
Put some saline and hydrogen peroxide. We're going to let this in. Oh.
Yeah, because you remember that one's open from that side, so be
Oh,
careful.
yes.
There you go. I was like, you're gonna get wet here in about 5 seconds. There you go. There you go. And I want that to be noted. I was nice. I didn't let her squirt herself like some of my instructors have done to me. Especially when you change into vent water. Oh yeah, that can be fun.
Alrighty, so first I'm going to take out your inner cannula. Perfect. And then I'm going to let this soak in hydrogen peroxide. I'm going to go ahead and get my brush and clean the inside of it. And we're going to clean the outside. And then we're going to rinse it off with some sterile saline. Alrighty, going to go ahead and put this back in, alrighty? There we go. Let me clean the outside. Okay. Now I'm going to take your gauze off. Alrighty, so wipe clean. And I'm going to swipe clean. Alrighty, now we're going to change your necktie, okay? Perfect. Now we're going to...
You're not loose. There you go.
Oh. Okay, so now I'm going to put on a new one.
The only reason why I'm telling you all for sure and catching you on but not let loose is I had a patient cough out their trach while I did it when I was a student. And we couldn't get the trach back in. Yeah. So I don't want you to go through what I did because I went through a lot of mental anguish over it. I was so upset. And I felt like I had done like an injustice to the patient. I was just really upset. So I'm very stickler on that.
You need to learn from things like that.
Yeah. Learn from our mistakes.
That's what we're here for.
Yeah. Because everybody does them. I mean, but you know.
Now
Learn
I'm going
from
to
our
put a
mistakes.
new gauze on you.
It took them a while. They finally got it in, but they had to cut around and cut in, and he just immediately shut up. And I don't know why, because he'd already had the treatment, he'd been there for a while.
Yeah.
I don't know what caused him to have a reaction like that.
Maybe the physical action of pulling it out
I
caused
guess.
swelling.
I guess. That's the only thing I could think of. When he coughed it out and it went out.
Was it cuffed, did you say?
No, it was uncuffed. Which was why it was.
Alrighty, Mr. Smith, you are all set
Easy
to
to get
go. Thank you. Let's put your oxygen back on you. Finish your therapy.
She did a good job. Did an excellent job.
Alrighty, thank you. We'll be back next tomorrow.